own neighborhood, putting the community they serve first. The community is one of the most important elements in maintaining continuity amongst its citizens. And this team of doctors are some of the best medical professionals in the state of Oklahoma. We'll spend the next hour learning the facts, dissecting and debunking the myths. And you will get the answers that you need to the issues that affect us all daily. Whether it's the latest COVID updates or a simple question about your child or other family member, we got you covered. This is Our Community, Our Health, right here on KBOB 89.9 FM and live stream worldwide at KBOB899.com. Now let's welcome your hosts.
Hey, what's going on, family? How we doing today? This is our next episode of Our Community, Our Health. This is Dr. Andre Perdue. It is a pleasure and an honor to be with you here today. Looking forward to spending an hour with you to educate you, to pour into our community so that we have the information that is needed so that we can get the best health care we possibly can. The show has been we have now been doing this now for close to 16 months. I think it's been a little bit more than 16 months. So, and it has been an absolutely fantastic experience. We appreciate you in the community, letting us know what your needs, what your desires are, the good, the bad, and the ugly of this particular program so that we can make it better. Because ultimately, we want to be a vessel for the community to give you the information that you need to get the best health that you possibly can. So again, it's Dr. Andre Perdue, and it's a pleasure being with you here today. Before we get started on today's topic, I just want to say I hope everyone had an opportunity last night to listen to Vice President Kamala Harris and what she had to say last night. That's about as motivated as I and my wife have personally been since Barack Obama was in office, talking about unity and talking about how we as Americans can get better. We are much better in unity than we are divided, which is the absolute mantra of the other candidate that we will not mention. It's just so refreshing to see a powerful, well-spoken African-American female that is representing herself, representing her country, and representing her race to the full. So I think one of the most important things that we can possibly say on today's show is please get out and vote, because your vote will play a prominent role in what our children and our grandchildren's life will be like. Because the other candidate is not about what is best for all. It's about what's best for a very select population of individuals who already are part of the haves. And, those of us that feel like we are part of the have-nots, we need to balance the playing field. And so it was a fantastic speech, very motivating. Looking very much forward to the September 10th debate. That's going to be very interesting, and we may find it might be kind of comical because Kamala is definitely going to make sure that she's going to put this other candidate on point. So that's my political statement. I'm not going to go any further than that. What we're going to talk about today is one of the most common, if not the most common, neurological conditions. It is headaches. It is one of the biggest challenges for neurologists and general practitioners to deal with, headaches and dizziness. And the reason why, there are many causes of each. And so we're going to talk about different types of headaches today. We're going to talk about 3 common headaches. And then we're going to talk about 2 headaches that are less common, but are medical emergencies that you need to be seen as quickly as humanly possible. So let's go ahead and get this party started. I want to start the day off with giving you guys the opportunity to call into the show. You can be my co-host and ask me questions. Our number is 918 area code 856-3873. Again, that's 918-856-3873. So please feel comfortable to give us a call. So let's go ahead and crack this egg. So headaches. How often do headaches occur, and what is the population that's affected? So we always talk about, we use the terms prevalence and incidence, and you don't necessarily need to know those, but mainly what that breaks down to is how often is it seen and how many people are affected. So the prevalence of headaches, it affects 4.3% of adults above the age of 18 in the United States. And so, we have well over 340 million people. So if you kind of break that out, 4.3% is a large number. I think that comes out to somewhere in the neighborhood of 39. I think it's 39 million people. And so actually our population is higher than I originally stated. So, but 40 million people have headaches. Okay. And so if you look at worldwide, with 40% of the population roughly being affected, we're talking about 3.1 billion people, and that's in the year of 2021, actually have headaches. So this is a very, very, very common condition. And with it being so common, it's something that there are things that we can do to manage that, both pharmacologically, as well as we can make some changes to diet and exercise and a variety of other things. So we're going to get into what some of those other areas that we're going to be able to kind of address. So, something to keep in mind, almost everybody has an occasional headache. And so if you get a headache every once in a while, it's not really something that you need to be all that concerned about, as long as it's not the worst headache of your life. So I believe it was maybe a month or two ago, I talked about hemorrhagic strokes, or talked about bleeding strokes. And one of the topics that I brought up was patients who have a subarachnoid hemorrhage, which mainly it means is that you have a leakage of blood into the skull, which adversely affects the brain. And for those individuals, they will have what is called the worst headache of their life. So they will say that they feel like they've been hit in the head by a sharp object, or they've been hit by a 2x4. It's literally something that people who have had it, they will tell you what they were doing, where they were, the exact date and time that it happened. It's a life-altering event. So if you have one of those type of headaches, even if it's the first time you've ever had a headache, if you have the ability to call 911, please do as quickly as you can. If you're around someone who actually has an event like that, got to call 911, because you're now embarking on a medical emergency. So again, patients, anyone can have a headache. Okay. So what are some of the leading factors that can cause people to have headaches? Okay. So foods. Allergies to foods can cause headaches. Alcohol intake, even a small amount. You can have a glass of red wine. For some people, that's enough to give them a headache. Heavy alcohol use typically will lead to headaches, as well as a variety of other medical conditions. Long time heavy alcohol use leads to issues with your heart. It can lead to issues with your GI system, as well as your liver and kidneys. Those can also be leading factors into why someone may have a headache. So something to keep in mind, alcohol can definitely have a deleterious effect when it comes to headaches. Bright lights can also cause it. When you go to Walmart, or you go to Reesers, or one of these grocery stores, they have fluorescent lights. And the reason why they have them is because they want to make the aisles nice and bright, so you can see all of the objects and entities that you need to buy. Well, people who have a predisposition to have headaches, when you're surrounded by fluorescent lights, it can lead to you having headaches. So if you do have a sensitivity to fluorescent lights, one of the things to do when you go into a grocery store, or you go into some place that actually has fluorescent lights, is wear sunglasses. I mean, that will help protect your eyes a little bit. And a lot of times that can help either alleviate a headache or minimize the risk that you will go on and have a headache. So we've talked about food, we've talked about alcohol, bright lights, stress. We are in a very, very stressful time of life right now. We're about to embark on an election that is going to change the scope of the direction of our lives, those of us who live here in the United States, as well as globally. It's going to affect us. So we carry that stress. We have the stressors of having children. We have the stressors of health. We have the stressors of employment. We have just a variety of different stressors. And as time has gone on, the stress level has gone up. social media in all of its glory, and everybody loves Facebook, and they love all of these different entities, whether it's TikTok and things of that sort, because of that constant barrage of information and the need to keep up with the speed of the information world. That leads to stress, and that can lead to more headaches. Some of the more recent information that's come out has actually stated that the incidence and prevalence of headaches is going up, and some of it, one of the reasons why it may be going up, is the fact that we're just dealing with just trying to keep up with all the information that is out there. And sometimes we need to unplug. I mean, that is something that we should all be doing. If you have teenagers or people in their 20s and 30s in your life, I can promise you they spend more time on their phone scanning through TikTok and scanning through YouTube and Apple Music and all of these other types of streaming systems, that as time goes on, we become more and more and more isolated. And as we become more isolated, one of the ways to minimize stress is actually to communicate, is to actually engage, is to assimilate. And so as we isolate ourselves more, we increase the stressors in our life, which can lead to us having a greater likelihood of developing headaches or having headaches. So just something to keep in mind. Another important factor is exercise. When we exercise is a fantastic way of helping to decrease stress. By decreasing stress, that can help to alleviate headaches. Also, by exercising, we tend to sleep better. And sleep is very, very important when it comes to managing headaches. So people who do not sleep well typically do not heal well. And people who do not sleep well typically have more issues with headaches and dizziness and a variety of other neurological conditions and complaints. And so it's very important that exercise, and we're not talking about trying to train for the Olympics, where you're working out 5, 6, 7 days a week. It's mainly a matter of just having a routine, at least 2 to 3 times a week, between 15 and 30 minutes of exercise. And if you're walking regularly, being out in this beautiful sunshine, hopefully the weather seems like it's getting a little bit better. It's not quite as hot as it has been. That is one way for you to get out and get some fresh air. Fresh air can also be a contributing factor in helping to aid in headaches and aid in just the healing process in general. I mentioned sleep. Sleep is incredibly important. If you look at people who have a regular sleep pattern, and that doesn't necessarily mean you got to sleep 6, 8, 10, 12 hours a day. But when you wake up, are you refreshed? Do you feel like you need to go lay back down to get more sleep? If you feel like you need to lay back down, you're not getting what we call restorative sleep, which is mainly the sleep that is going to allow you to kind of get through your day and to function at your highest capacity. So people who do not sleep well will tend to have headaches. And if you have headaches, there are some types of headaches where people will say, and the medical establishment says that for migraines in particular, if you can go to sleep, you can actually abort a headache. Well, if people have underlying history of having poor sleep altogether, it makes it hard for you to abort migraine, and it can also increase the tendency for you to have migraines. So, when we talk about, again, potential causes, we talk about foods, eating regularly, eating healthy foods, minimizing salt, things of that sort. Alcohol consumption will increase your headaches. Bright lights, particularly fluorescent lights, can lead to headaches. Stress can lead to headaches, and there's there are good stressors too, but particularly the types of stressors that we are inundated with on a daily basis, whether you're driving your car home from work, or whether you're dealing with stressors at work or children or things of that sort, they can be contributors. As well as exercise is important in helping to regulate your headache profile, as well as sleep. So just keep those 6 entities in mind when it comes to try to manage your sleep, manage your headaches, excuse me. Okay. So what happens if you have headaches regularly? What should you do? Okay. Well, one thing that I think is vitally important is to keep a headache journal. Because when people know what their triggers are, and we talked about some of the potential triggers just a couple of minutes ago, if you know what your triggers are, if you are able to remove those triggers or to minimize them, then that gives you a better chance of actually managing your headaches most efficiently without necessarily needing any type of pharmacological aid. Okay. So keeping a headache journal is vitally important. And that's one of the things that I will tell my patients, whether it be in clinic or whether I see patients in the hospital that have headaches or have other conditions, whether it's seizures or a variety of other things. If you have an idea of what your triggers potentially are, you can better manage those. And, again, that leads us to, it empowers us as opposed to the feeling that, hey, I've got to go to someone else to solve my issues. If the more in tune you are with your own medical issues, the better off you are in being an active participant in your own healthcare. So, what do you write in your journal? Okay. Well, one, you want to write your frequency. How often are you having headaches? So there is a number that if someone is having headaches, and that's whether you're having the beginning of a headache or a headache kind of extends into multiple days. If someone is having 15 days of headaches, or essentially at least half of the month you have headaches, you are someone that needs to see a specialist. And that specialist is someone that can really help you from the standpoint of getting a medication to you that will hopefully not only stop your headache, but will help to minimize you from developing a headache. And those are two different entities. One is you can develop a headache. Once someone has a headache, it's hard to stop certain types of headaches. And migraine is one in particular that can be very difficult to try to manage. And we'll talk a little bit more about that in our next segment when we talk about specific headaches. But migraines are difficult to manage if you don't jump on it right away. And so if you sometimes we give patients medications to decrease the number of headaches they may have per month so that will decrease the number of headaches that they have in the month and give them more quality of life. Then you have patients who will have a headache and the headache, it lasts for a week. Okay. Well, the longer that headache lasts, the harder it is to stop the headache. And we have patients that will come to the hospital and say, well, I've had a headache now for 2 weeks and I can't deal with it anymore. And, we will try a variety of different type of entities and agents to try to manage that headache. But a large percentage of those patients will go home with a headache because you just have to take the medications that we've given and you just got to give them a chance to work. And sometimes it takes a number of days for that headache, that specific headache, for it to be managed. So you really want to jump on it as soon as you possibly can. And the sooner you jump on it, hopefully you won't get into one of those headaches that will last long periods of time. In your journal, you should also write down what you're eating, what you're drinking, what you're consuming, as well as how well you're sleeping. Because again, you may very well find a trend that if I eat, if I eat popcorn or if I eat a certain type of pasta, that may lead to me having a migraine the next day. Well, okay, well, let's try to avoid the popcorn or the pasta or whatever that particular agent may be that's leading you to having a headache. How well you sleep. You may very well find that, if I get less than 6 hours of sleep, or I have sleep that is not restorative sleep, I will tend to have a headache the next day. That's very, very common. So, when you are able to write those things down, you will also be able to know that, hey, you know what? If I need to make sure that I go to bed early, or make sure that I'm not drinking a glass of wine before I go to sleep, because when I do that, when I wake up in the morning, I have a migraine. Another really important point is caffeine. Caffeine is a contributing factor to patients developing headaches, particularly migraines. Your caffeine consumption. I've seen it a handful of times where individuals who are lifelong coffee drinkers decide that, I'm going to stop cold turkey and drinking coffee. And literally within a day or two of doing that, they will have a terrible headache. And it's typically in the form of a migraine. I've even had a couple of patients that literally had to come to the hospital because they felt like it was the worst headache they've ever had in their life. So the thing with caffeine is that, if you're going to, stop caffeine, you'd have to literally taper yourself off of coffee or taper yourself off of tea. Coffee tends to have more caffeine in it than tea does. It also tends to have more than most soft drinks, even though there's some soft drinks like Mountain Dew and things of that sort that are very, very high in caffeine. So, writing those objects down into your journal empowers you so that when you do see your primary care doctor or you see your neurologist, you actually have some information. You can actually walk in and say, hey, you know what, I've noticed this trend that, if I stop drinking my coffee, or if I don't get at least 6 hours of sleep that is rejuvenative for me, that I have a headache. Well, you know what, you actually making that statement to your doctor actually will put your physician on point, because now it's not a matter of, okay, well, hey, this is an individual who, has bought into their own healthcare. And so I have to make sure that, I cross T's, dot I's, do the things that I need to make sure that this particular patient gets everything that they possibly need. So, that's a source of empowerment, you actually having that information. So I think now is a good time for us to take a small little break. And when we come back, we're going to talk about different types of headaches and maybe some of the things that we can possibly do to manage those. So come on back. Come see us.
This is KBOB 89.9 FM, Tulsa. And now streaming 24/7 live from the Eden Media Studio. 24/7 live at KBOB899.com.
How to order chicken wings. Number 1, find a good wing spot.
I know a wing spot, Max Wings.
Number 2, decide if you want a combo or if you want to order a la carte.
Huh? What's that?
Well, combos come with chicken, veggie sticks, fries, and a drink for a discounted price. A la carte means that you order each item separately.
Okay.
3, decide if you want bone-in, boneless, or cauliflower wings, and then determine the delicious flavor you want on your wings.
I didn't even know cauliflower had wings.
You learn something new every day. Have you been to Max Wings?
Yep.
Max Wings is located at 782 East Pine Street in Tulsa. We're open Monday through Thursday from 11 a.m. to 8 p.m. and on Friday and Saturday from 11 a.m. to 10 p.m. Come to Max Wings, home of the dry rub fries.
Young growing peoples, and we love that funk they play on KBOB 89.9 FM. Don't you stop it, don't you stop music.
Fitting Back In is a reintegration program designed to help those released from prison to fit back into the community as productive, valuable members of society. They help schedule various classes such as anger management, substance abuse, and mental health. They also work with different programs in the community to provide job training. If you or someone you know needs help with resources in career development, employment, or housing, to find out more information, call 918-592-3500 or stop by 2121 North Harvard Avenue, Monday through Thursday from 9 a.m. to 2 p.m.
Hey, folks, we're back. Again, this is Dr. Andre Perdue, and today's topic is headaches and different types of headaches and management of headaches. So first segment that we talked about some of the different triggers for headaches. We talked about the prevalence and the incidence of different types of headaches. And so let's get into the meat of the topic here. And we're going to talk about different types of headaches. So and I'm going to try to focus on the most common ones. So the most common headache, and one way to think about headaches is the location that they tend to affect. Okay. So the most common type of headache is something called a muscle tension headache. And a muscle tension headache, people will typically feel a band sensation around their head. Now, almost feels like your head is in a vice grip, is being squeezed. And really the origin of that are the muscles in the back of your neck, your cervical muscles. And one of the typical reasons why patients will have muscle tension headaches will be because they may have some degenerative disc disease in their neck. That can be a contributing factor. Also, sometimes patients who tend to wear, tight hats or bands or things around their head. Sometimes that can predispose individuals to muscle tension headaches. So muscle tension headaches are usually best treated with over-the-counter medications. They're usually not very debilitating. One of the challenges that you run into is that if you do have some degenerative disc disease in your neck, you will have a larger likelihood of having headaches more often, muscle tension types of headaches. So with that being said, sometimes going to a chiropractor, I'm not a fan of the twisting of the neck, but just gentle tension on the neck can help to alleviate some of the stress in the muscles. Muscle massage is actually great, massage therapy. So whether you can coax your mate into giving you a massage, or whether you go to a masseuse, that a lot of times that will help to alleviate some of the stress in the neck, and being on a regiment of doing that on a regular basis can sometimes help to alleviate muscle tension headaches. A lot of times over-the-counter medications, whether that be Tylenol, Advil, Aleve, it tends to work pretty good as far as managing those. The second type of headache is migraines, and migraines tends to be more of a throbbing headache in the temporal area or near your ear. And it can go from one side to the other. It's not always on one side. If it is only on one side, that's something to be a little bit aware of, because typically migraines will tend to be more on one side than the other, maybe 75% of the time on the left or right and 25% on the other times, but it does tend to move a little bit more. It is most commonly seen in women. And one reason why is that migraines has a pretty significant hormonal component. Women tend to get migraines more, after they start their menses. It's roughly a 3 to 1, 4 to 1 ratio of women to men when it comes to actually getting migraines. So some of the features of migraines, besides that throbbing headache, nausea can accompany it. Vomiting can accompany it. More nausea than vomiting. Also, there are types of migraines where you will have a visual aura, whether that is kind of a halo appearance in your eye, or sometimes people will say that they see a purple shimmering line or a kaleidoscope, or almost like a snowfall. Are just some of the typical visual phenomenon, or what we call visual sclerotomas, that you can see with a migraine. Very, very important point. And one of the take-home points I want you to make of this is that when someone has migraines and they have a visual aura, it is what we call a positive phenomenon, which mainly means that, it is usually color associated with it. There is bright light associated with it. The reason that's important is that if someone has a situation where they lose vision in their eye, so you feel like you have a curtain that's coming over your vision, or the vision goes black and you have a headache, migraines don't do that. Okay. A stroke can do that. And so, or what we call a TIA, or transient ischemic attack, can do that. So there's a big difference there. And typically we see patients who have a history of migraine, and then they go through menopause, and they're in their 60s or 70s or 80s, and they have this phenomenon where they lose vision, and they think, oh, I thought it was part of my migraine. Now migraines were coming back. Well, migraines don't do that. And typically when women go through menopause, their migraines tend to get better. They may not go completely away, but they tend to get better. So important to know the difference between a positive phenomenon, which mainly means that there's color or there is light that is associated with with your visual field. We see that with migraine. If someone has a negative phenomenon, which mainly means that you lose vision, okay, everything goes black, that's not part of migraine. You can see that with stroke. So with that, got to come into the hospital. Okay, you gotta make the trip to the hospital. And I know some people would say, well, let me just call my primary care physician. I don't know when you're going to get into your primary care physician. So the best thing for you to do is come to the hospital where I can see you, or one of my colleagues can see you, where we can then better ascertain whether or not this is a acute issue, chronic issue, or what things do we need to do to ultimately, hopefully, preserve your vision and minimize your risk of going on and having a stroke. Okay. So, migraines are the most common. Those are some of the things that we sometimes see with a visual aura. Not always, but we can see that. Sometimes patients will have nausea. Sometimes they will have vomiting. Patients almost always have sensitivity to light. So, we talked about earlier, you walk into a Reese's and immediately get a headache. Well, if you got a headache already and you walk into Reese's or walk into a store that has fluorescent lights, it's only going to make your headache worse. And most people don't necessarily even want to leave their house when they have a migraine. So, it's kind of one of those things that if you do have to get out and about, it's really important for you to try to wear some sunglasses, because that will help to minimize your overall risk of the headache getting worse. And ultimately, I think it can help you feel significantly better in the long term. So just something to keep in mind in regards to that. Other things to keep in mind when it comes to migraine is that you not only have sensitivity to light, but you can have sensitivity to sound. So, people who have migraines will typically want to be in a dark room and a quiet room. Okay. And we're going to talk about another type of headache that you almost want to be in an opposite environment. But it has been known and shown that if you have a migraine, if you're able to go lay down in a dark room, in a quiet room, and go to sleep, a lot of times that is one way to help to manage your headache, where your headache will get significantly better or may go completely away. So, that may be something to consider for someone who is having a migraine at that particular time. So, throbbing headache, okay, and it can isolate, go from one side to the other. 2, some patients will have what we call a visual aura. 3, patients can sometimes have nausea and vomiting, not all the time, but it's one of the more common side effects or symptoms that we see when someone has a migraine. Also, patients can have photophobia, which mainly means sensitivity to light, or phonophobia, which mainly means sensitivity to sound. Okay, so those are some of the typical things that we will see when patients have migraines. Okay, now, important thing to keep in mind about migraine, and it's something that I see quite commonly in the hospital, in the emergency room. I'm going to give you a scenario here. I've got a 34-year-old female who comes in who is having a terrible headache. And it seems like it has the consistency of a migraine, where it's throbbing headache. And the patient also has numbness and tingling on one side of their body, or they have weakness on one side of their body. And so when that patient comes into the hospital, our thought process first is, could this patient be having a stroke? And unfortunately, we have patients that are in that age range that have hypertension or may have diabetes, and they may be smokers. They may have other type of risk factors that could lead us to think that this could possibly be a stroke. So we always want to err on the side of being as aggressive as we can, and not necessarily minimizing someone's symptoms. So when we do that patient's workup, we may end up doing an MRI scan, which is a fantastic screening test. We will look at their blood vessels. All of that information comes back negative. Yeah, but they still have a headache. And so what we would then do is attempt to treat the headache. Once we treat the headache, sometimes the symptoms go completely away. And so that is a patient that has what is called a complex or complicated migraine, where they have all of the features of a migraine, but they also have neurological symptoms such as weakness or numbness or dizziness or a variety of other things. So it's important for that individual to come into the hospital, because by coming to the hospital, it gives us the opportunity for us to do an appropriate workup on that individual, so that we can really determine what is going on. Is this a stroke in a young patient, which we do see, or is this a migraine or a complex or complicated migraine? For some of those individuals that actually have weakness, or sometimes they're paralyzed on one side of their body, there is a type of migraine. It's called hemiplegic migraine, which is a fairly uncommon type of migraine, but it is something that we see, and that can absolutely mimic someone having a stroke. So again, that's when we got to get you to the hospital so that you can be properly evaluated. Okay, so wanted to make sure that I made that aware to you guys, that we do see sometimes that patients have headaches like that. There are sometimes that patients have migraines, and that migraine can lead to them to having a stroke. And we call that a migrainous stroke. So, headaches, complex. We have, there are fellowship programs throughout this country that specifically are geared to helping neurologists learn all that they possibly can about migraines. And we actually have a fantastic headache specialist here in town, Dr. Jacqueline Duvall, who works very closely with Hillcrest Medical Center. So, there are people here in the case that if you have very unusual and complex type of headaches, to help to manage that if it cannot be managed by your primary care physician, or if your neurologist, if you have a neurologist, is having some difficulty with getting things under control. So, we talked about muscle tension headaches, okay, which is the most common headaches. Feels like your head is being squeezed, like it's being squeezed in a vice grip. And we talked about kind of the management of that with over-the-counter medications, as well as traction and muscle massage. Actually, can be very beneficial. We talked about migraines, the different features of migraines, more of a throbbing type of headache where you have. You can have nausea, vomiting, sensitivity to light, sensitivity to sound, and there's even some features where you can get neurological conditions like weakness or numbness that can be associated with a type of migraine. We call that a complex or complicated migraine. The third type of headache is what is called a cluster headache. A cluster headache is, for lack of a better description, is people will say, like, I feel like I'm being poked in my eye by a sharp object. And so it's usually centered right behind your eye. There's a lot of pressure and there's pain behind your eye. People who have cluster headaches typically are pacers. They will tend to kind of pace around the room. They can't necessarily lay down in a dark, quiet room like someone who has migraines. They want to pace. They want to be moving because they're in pretty significant discomfort. It's usually fleeting. And so it will usually last a matter of seconds, a real sharp pain, and then it goes away and then it'll come back. And then the reason we call it a cluster headache is the fact that you can have tens to hundreds of these type of events over a number of days or weeks. And we've even seen patients that have committed suicide because the pain was so significant and so severe that they thought it would never end. And so it was something that they felt like they just couldn't deal with. So you're talking about, one of the more debilitating types of headaches when we talk about cluster headaches. It's interesting, the way that you typically treat cluster headaches is with oxygen. So if you were to come to the hospital and you had a cluster headache, or you're in a kind of a series of cluster headaches, we would typically give patients a high dose of oxygen, usually 7 to 10 liters of oxygen over a 10-minute period of time. And a lot of times that will abort the headache. We also tend to treat it with non-inflammatory steroids. So things like naproxen and that whole family of NSAIDs, pharmacological NSAIDs, has been shown to be very effective. It's thought to be due to kind of inflammation of one of the nerve ganglia that's behind your eyes, the reason why people have cluster headaches. So again, we talked about muscle tension headaches. We talked about migraines. We talked about cluster headaches. And so now I want to talk about two types of headaches that are life-threatening headaches. And so we want to make sure that you guys listen up for that. We're going to take a slight little break here. Going to come back in a couple of minutes, and then we're going to talk about migraines.
Hearts of many.
And we're going to talk about subarachnoid hemorrhages. Come on back.
We're like Radio Network continues to expand as influencers in the community of North Tulsa and beyond, but can't do that without your help. That's why it's important that we as a community continue to support the Juice Radio Show and keep 89.9 on the air. The community not only deserves this service, but needs this service. Let's continue to support the mission and giving a voice to the voiceless and donate to the Juice Radio Show. The Juice Radio Show is a nonprofit 501c3 powered by KBOB KBOB 89.9 and Eden Media Services, operating solely off the gifts, donations, and contributions made by listeners like yourself. All donations made to the Juice Radio Show are tax deductible and can be sent to 1216 North Lansing Avenue, Suite D, Tulsa, Oklahoma 74106.
It's Tulsa, I see you here in Tulsa. I'm in Tulsa chilling.
We appreciate your continued support and thanks for listening to KBOB 89.9 FM.
The 36th Street North Event Center is a full-scale event center where we share the experiences of the community. At the event center, you can rent space for weddings, birthday parties, receptions, concerts, Greek events, quinceañeras, and much more. We also do custom decor, linen, and centerpieces. We're located at 1125 East 36th Street North. To book your next special event, business gathering, or community event, call us at 918-200-9046.
This is KBOB 89.9 FM, Tulsa. And now streaming 24/7 live from the Eden Media Studio. 24/7 live at KBOB899.com.
Hey, folks, we're back. This is Dr. Andre Perdue. We're talking about headaches. We've talked about different types in the last segment. We talked about migraines. We talked about muscle tension headaches, and we talked about cluster headaches and some potential treatment plan for each of those and some signs and symptoms. And so what I want to do in our last segment is I want to talk about the life-threatening types of headaches. And because listen, nobody wants to go to the hospital for every time you have a headache. And to be honest, that's not the best way to manage your headache if you're going to the hospital every time, because just being in the hospital itself increases your stress. You're under bright lights. Sometimes it will make your headaches worse. But there are a couple of occasions that it is vitally important for you to be seen as quickly as you possibly can, because these are headaches that could lead to significant morbidity and mortality, which mainly means it can make you feel real bad and be real sick, or it can actually kill you. Okay. The first one is something called meningitis. Okay. And meningitis, it really means it's inflammation or infection of your meninges. And meninges are the tissues that lie over the surface of the brain between the brain itself and your skull. And within your meninges, you have pain fibers. So inside of the brain itself, sometimes if I hear people say, well, you know what, I've got a migraine, so that means my brain hurts. Well, actually, technically, that's not true, because the brain itself does not have pain fibers, but the tissue over the surface of the brain does have pain fibers. You also have pain fibers that run within the blood vessels that go to your brain. So typically when people are having migraines, it's because of irritation of the blood vessels that are actually running through the brain. And so that's why some of the medications that are used are medications really geared to kind of help with that. So meningitis is inflammation or infection over the meninges of the brain. And the thing to keep in mind about the brain is that the brain is encased in a bone box. We call it the skull. And within the skull, there are three things. There's brain tissue, there are blood vessels and blood, and there is, and then you also have your meninges, which you have cerebral spinal fluid that actually runs through your meninges. So if you have an increase in one, then you're going to have a decrease in one or two of the others, or the pressure goes up in your head, inside of your skull, and that pressure can lead to a loss of consciousness, as well as focal neurological symptoms, whether they be stroke-like symptoms or confusion or a variety of things. So when someone has meningitis, they typically will have a bad headache. They typically will complain of neck pain. A lot of times they'll have body ache. They will have fever. They will have chills. But the most important feature probably is the fever. When somebody has a bad headache and they have a fever, one of the first things that comes to mind to me as a neurologist is, could they have meningitis? And so it's important to get the fever under control. And of course, we can do that with ice baths, and we can do that with Tylenol and a variety of other things. But the way the body is fighting the infection is trying to raise the temperature to kill off whatever the organism is that's causing the infection. So when someone has meningitis and they have headaches and neck stiffness and fever, you need to get to the hospital right away, because what we need to do is we need to collect some of the fluid from the brain or from the central nervous system. We can do that by taking some fluid from the lower back, and then we'll run it for certain cultures and see exactly what kind of infection it is. It can be either a viral infection, which is usually pretty self-limiting. There are people who have meningitis that just stay home for a week and they feel terrible for that week. But, usually after 8 to 10 days, they start to feel a little bit better and they kind of get back into their routine. That is not something I am advocating. Let me say that again. I am not advocating for you to stay home if you got a bad headache and you got a fever. You need to come to the hospital. But that's what some people have done. But you also have you can have a viral infection, but you can have a bacterial infection. A bacterial infection can kill you. Every year we have, hundreds to thousands of people. It's more in the hundreds, kids that go away to college, or they're in high school, or, they're relatively young, who end up getting a terrible fever. They have bad headache, and they don't make it to the hospital, and they can have a pneumococcal meningitis. There are other types, the streptococcal meningitis that can kill you literally within a matter of days. A virus usually is self-limiting, which mainly means that, you'll get pretty sick, but usually patients, with medications will do well with that. If you have a bacterial meningitis, we can put you on medication. You might not survive it. So again, we're talking about life or death situations here that you need to be seen as quickly as humanly possible. So meningitis, bacterial meningitis, is a life-threatening, life-altering, life-ending type of situation. So there are some cases that patients will have a fungal infection, and usually fungal meningitis, it takes longer. It tends to occur more in immunocompromised people. So if you have someone who is on steroids for lengthy periods of time, or someone who may have HIV or AIDS, or have other conditions that can lead to immunosuppression, which mainly means your immune system doesn't work very well, you can get a fungal infection. And those can be very difficult to treat. And they can be very, very debilitating. But if I had to rank the three of these between most serious, bacterial meningitis would be considered the most serious because it can kill you in days. Fungal meningitis would be considered the second worst because it can kill you, but it typically will kill you within weeks or months. And viral meningitis would probably be the least virulent because it's usually self-limiting. People have died from herpes meningitis and Epstein-Barr meningitis and CMV meningitis, just as happens, but it doesn't happen very often. It's fairly uncommon and usually tends to occur more in people that are immunocompromised. So, very important for you to keep that in mind. Meningitis, life-threatening condition, got to be seen right away. And typically you have bad headache, you'll have neck stiffness. We use the term nuchal rigidity as a term for that. And patient would typically have a fever. Sometimes they'll have a rash. And if a patient has a rash, that tends to be more likely a bacterial meningitis. And so again, you got to come in right away. Okay. So that's meningitis. The way that we typically treat it is with IV antibiotics or IV antivirals or IV antifungal medication. It's not the kind of thing that, hey, you got meningitis, take a couple pills here and then go on home. Now, we've had patients that have come to the hospital and their viral load is so low, which means they probably fought off the majority of it. And then we end up getting them out of the hospital and we may send them home on oral medication. But the typical plan is IV medication, and IV medications gets into your bloodstream faster and is much more potent than anything you can take orally. So keep that in mind. Okay, so that's meningitis. The second entity, I actually talked about this, I believe, a month or two ago, and when I was talking about hemorrhagic strokes, is that subarachnoid hemorrhage. A subarachnoid hemorrhage is usually a situation where someone has a aneurysm, which is mainly an outpouching from the wall of an artery in the brain. It can occur anywhere, but particularly we're going to focus on the brain here, that leaks blood. And so again, using the analogy I used before, that there are three things in the skull. There is blood, cerebrospinal fluid, and brain tissue. If you increase the amount of blood in the brain, that means you got to either get rid of cerebrospinal fluid or you've got to get rid of brain tissue, or the pressure goes up and patients will typically lose consciousness. And it can be a situation where someone does not survive. If you were to take 100% of individuals that have subarachnoid hemorrhages, 33% of those never make it out of their home. They die at home. 33% of those make it to the hospital, but die in the hospital. And then you have 33% that will tend to survive. Now, what state that they're in all depends upon the degree of subarachnoid blood. It depends upon their treatment, depends upon their overall health. If you've got somebody who's got a multitude of medical conditions, high blood pressure, diabetes, elevated cholesterol, they're smokers, they got all of these other medical conditions. Those individuals have a harder time with recovery than someone who does not have those medical conditions. So there are a lot of factors that can go into how someone is going to do. But again, a third of patients never make it out of the home because they die at home. A third die in the hospital. And then you have the third that survive. And then with that group, it's a matter of just trying to get them into a rehab setting and trying to get them functioning at as high a level as we possibly can. So those are patients with subarachnoid hemorrhages. Again, another medical emergency. Patients will say, worst headache of my life. I feel like I was hitting the head with a baseball bat, or I feel like I was struck by lightning, or I feel like, somebody hit me in the back of the head with an axe. It will give you all of these very elaborate descriptions of having severe pain. It is literally, it's life-changing pain. People can tell you exactly what they were doing, exactly when they were hit by it, and how they were affected by it. And, there's probably very few things other than, when you got married or when you had children or things of that sort that we can remember to that type of detail. So it's a life-altering event. Patients who have subarachnoid hemorrhages are individuals that we have to treat very aggressively in the hospital, usually by first trying to secure or treat the aneurysm. And then once we secure the aneurysm, then it's a matter of dealing with the after effects of the blood. And the after effects of the blood can cause swelling in the brain. And the swelling in the brain is usually managed with different solutions that we're trying to decrease the swelling, decrease extra fluid that may be in the brain. Patients typically will have between a 14 and 21 day course in the hospital, where we just have to keep a very, very close eye on them, because patients can do well from the procedure of treating the aneurysm and still have a bad outcome. Some of that depends upon, they can have spasming of blood vessels, they can have a stroke that can occur, a variety of different things that can unfortunately change the overall outcome from the procedure. So it's very important that we get patients seen as quickly as possible, get them managed as quickly as possible, and then from there have fervent conversations with them and their family in regards to things that they need to expect when it comes to the management and how well they're going to ultimately do from having a subarachnoid hemorrhage. Patients can also have a bleeding stroke within the brain itself, where they can have bleeding into either their ventricles or into the brain that can cause, again, severe headache. It's not typically due to an aneurysm. It's typically due to poorly controlled blood pressure, or if somebody is on a blood thinner, or if they fall and hit their head in a motor vehicle accident, just to name a few possible causes of why something like that will happen. But hey, again, that patient needs to be in the hospital, and they need to be closely monitored. We need to do imaging studies. We got to control their blood pressure, as well as try to make sure that the family and the patient has a good understanding of what the expectation is in regards to what the plan is moving forward. Okay, so we are entering the last couple of minutes of the show. Just a quick recap. We talked about today, we talked about headaches, okay? And we talked about different types of headaches, which includes muscle tension headaches, which is most common. We talked about migraines, which there is a 3 to 4 to 1 incidence in women than men. We talked about cluster headaches, where someone can have a feeling that they're being stabbed in their eye by a sharp object. And we also talked about a couple of incidences that can lead to death if somebody has a headache. And one of those, again, could be meningitis. Another could be a subarachnoid hemorrhage or a type of stroke where you have bleeding in the brain. So, it's very important that, we keep in mind that headaches are common. You know what? We all get headaches at some time. Unfortunately, there are some individuals that tend to get headaches much more often. For those individuals, you know what? Keep a headache journal. If you keep a headache journal, that can give you an idea of what your potential triggers might be. And if you have an idea what your triggers are, you may very well be able to manage your headaches by regulating certain foods or increasing your exercise level or making sure that you get good sleep. Sleep is incredibly important. I can't say it enough how important sleep is, not only in headaches, but in general health. I think we've taken sleep for granted for so long that there is a subset of individuals out there who are not healthy because of the fact they just don't sleep well. And so by managing your sleep, that can go a long way towards helping headaches as well as just helping you in general. Your caffeine level is really important too. So if you're trying to go from drinking a pot of coffee to a cup of coffee, and you're trying to do that in a 2-day period of time, you're going to have a rip roaring migraine. So need to do things in moderation. I think it is a good idea to go from a pot of coffee down to only 1 cup, but you got to do it in a regimented fashion so that your body can kind of get used to that. So the headache journal can be vitally important. Know your triggers. Potential triggers could be caffeine, can be alcohol, excessive alcohol. Smoking can actually cause headaches, for people who are longtime smokers or they smoke, multiple packs a day. Cheese, there's certain chemicals in cheese that can lead to headaches. One of the things that we're commonly going through on a daily basis, being a person of color, but particularly in this time of year, as we embark on looking for our next president, is stress. Stress plays a prominent role in headaches and a prominent role in overall health. It can lead to an increase in blood pressure. It can lead to an increase in blood sugar or changes in blood sugar. So, being able to know what your stressors are and being able to try to modulate or manage those stressors can go a long way towards helping you to not only manage your headaches, but to just feel better in general. So we're going to go ahead and close the show out. Listen, it has been an honor and it's been a pleasure being with you guys again. Headaches are something that a lot of us tend to take for granted. I try not to. As a neurologist, I am very fortunate and blessed that I don't have headaches. But my wife sometimes will get a migraine, and typically she gets something called ocular migraines, where you'll get a migraine where it will affect your vision, but you may not necessarily have a headache. But it can be pretty debilitating. And so, in my household, we try to be very sensitive when it comes to migraines. Women, again, tend to be more affected than men. But you can empower yourself by knowing what your triggers are, knowing what your frequency is, how often are you getting a headache, and also knowing that by you having this information, that it can go a long way to helping you to decrease some of your stressors, manage your sleep better, manage your diet better, exercise better, so that if there is a way to minimize your need for medication, let's try to do that. But if there are medications that are needed, your primary care physician, as well as neurologists, and I didn't go over a lot of those medications because we probably need a whole nother show on some of those, but there are medications that are out there that can absolutely help manage your migraines or manage your headaches better in general. Whether you're taking something to stop a headache once it's started, we call that abortive therapy, or whether we have you take something that will hopefully decrease your frequency of headaches over time. And we call that prophylactic therapy. We use prophylactic therapy and abortive therapy quite common for patients that have migraine. So again, be blessed. It has been an honor and a pleasure to speak with you guys again today. We as a battery of physicians, we love our community. We love you guys. We want to try to do the very best job we can to make sure that you have all the things that you need ultimately to be the best version of yourself for both you, your family, and your community. Last thing I want to say is please, please, please go out and vote. God bless.
You've been listening to Our Community, Our Health, the show that's putting the community first, not last, and will always bring you health news that can improve your daily life. The doctors you hear on this show have spoken freely and openly about various medical experiences. Any medical advice should be taken as just advice. If you're currently experiencing any health issues, please consult your primary care physician immediately. The views, thoughts, and opinions of such hosts and/or doctors heard on this program are that of their own and do not necessarily represent the views of KBOB 89.9 FM or Eaton Media Services. Thank you for listening. We'll see you next week. This is KBOB 89.9 FM, Tulsa. And now streaming 24/7 live from the Eaton Media Studio. 24/7 live at KBOB899.com.